Hi, everyone. Just a little background about leukemia before getting started. Leukemia, as defined by Leukemia and in Lymphoma Society, is a type of cancer that affects the blood and bone marrow. The cancer begins in the bone marrow from one cell that eventually mutates and becomes a type of leukemia cell. Once this change occurs, the cells begin dividing and growing rapidly. These cells are able to survive more successfully than normal osteoblasts and osteoclasts in the bones. With such growth, eventually there is no room for the normal cells, and leukemia takes over development. There is no normal rate for leukemia, as every type is different. For example, there is acute lymphoblastic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, chronic myeloid leukemia, and many, many others. It is important to know that those that are diagnosed with leukemia may continue to live good quality years. However, early detection is vital to being able to beat the cancer. In the case of chronic myeloid leukemia, for example, patients may not have noticeable symptoms until blood work is done, as they generally develop gradually. Some of the symptoms include weakness, fatigue, shortness of breath during basic everyday activities, fever, bone pain, unexplained weight loss, pain or a feeling of fullness below the ribs on the left side due to an enlarged spleen, and night sweats. Treatment is a viable option in many cases through a hematologist-oncologist. Treatment may include leukapheresis, the lowering of high white blood cell counts, tyrosine kinase inhibitor therapy, chemotherapy, immunotherapy, stem cell transplantation, and clinical trials. The treatment used will be dictated by which phase of leukemia the patient is in. Treatment of chronic phase, CML, treatment for accelerated phase, and treatment for last crisis phase. According to the National Chronic Myeloid Leukemia Society, as many as 1 in 559 will be diagnosed with leukemia in their lifetime. Though leukemia is a serious cancer and should be taken with the utmost care, knowing your body and having regular blood work done may help diagnose leukemia early on and save a life. Thank you.